If you look back at some of the studies that have looked at some of the A1c goals and things like that, they've done several like head-to-head studies with more strict goal versus relaxed goals. The one I always think about is the Accord trial. So Accord basically took patients, and I think the more relaxed goal got to like a 7.5, I believe, and then the more strict goal I think got down to a 6.4. They actually saw a higher chance of mortality in the more strict guidelines. And their initial goal, I think, was 6, but they didn't even get there. They got 6.4, I think, was the average. I may be off a little bit on those numbers, but
I think
pretty
6.4
sure that's right.
was, they were shooting for 6, they got to 6.4.
Okay, cool. So, in that 6.4 is, there's several patients that I've seen that would meet that criteria, and they actually had a higher chance of mortality, and the most of the mortality was stemming from hypoglycemia type issues.
Right, and the drugs they were using at that time were risky drugs,
more risky to cause that kind of thing.
Yeah.
So, but it was one of those things that because we didn't see not only any benefit, but we also saw increased harm in that particular trial. We kind of steer away from some of those more strict A1Cs. At least I do personally. I think Cole agrees. But then they also had studies like the Advanced trial. They did VADT. They did UKPDS. They did several studies, and they basically saw that maybe some microvascular complications can be reduced as far as the risk, but macrovascular in regards to MI, stroke, things like that, those are not
the important
different.
things.
Yeah,
things that kill you.
And those are not reduced with lower A1C goals. And I think the type 1 study that they did, like the DCCT and the EDIC trial, I want to say it was almost 20 years before you like truly saw a benefit from having the lower A1C goals.
Like below 6.5-ish, right?
So it's one of those things, if you have a much younger patient, maybe in that case it'd be reasonable. But if you're dealing with somebody who's in their 50s, 60s, comorbidities, I personally don't like to push them that low. No. But that's just me.
But as far as hypoglycemia goes, they did add in a little blurb that the occurrence and risk for hypoglycemia should be reviewed at every encounter and investigated when need be. Though I would feel that would be common sense. I guess they just threw that in there for completeness sake.
Yeah.